class. Today we're going to be talking about the anatomy of the arm and the forearm. So we will start the discussion with a talk about the arm, which is the proximal component of the upper limb. Before we get into a discussion about the arm and its muscular attachments and some of the nerves and blood vessels that are moving through it, it's important to understand some of the bony landmarks that are at play within the arm, notably those coming off of the humerus. So if we look at this anterior view of a humerus, this is a right humerus. So we have a lateral margin here, and we have a medial margin here. Same on this side, we have a lateral margin and a medial margin. We can observe some structures, notably the lateral epicondyle and the medial epicondyle. Here at the articular surface, we have a capitulum located laterally and a trochlea located medially. Superior to the trochlea, we have the coronoid fossa anteriorly, and then posteriorly we have the olecranon fossa. Both of these fossae are impressions for the ulna of the forearm to sit inside of. Moving past the bones of the arm, we have other bones of the forearm that articulate with the humerus of the arm, notably those being the radius and the ulna. Important bony landmarks of the radius and ulna that articulate with the humerus are the head of the radius, the radial tuberosity, the radial notch of the ulna, the olecranon process of the proximal ulna, and a coronoid process that is distal to the olecranon process. And lastly, this trochlear notch, or this semilunar notch. These components are going to be directly interacting with components that are in the arm. This is just another view of the articular surfaces of the bones in the arm and the forearm and how they would be aligning before they completely come together. So, similar to the shoulder, the elbow complex is a complex of joints that consist of articulations between the three bones previously mentioned, those being the humerus, the radius, and the ulna. However, unlike moving the whole upper limb the way the shoulder complex does, the elbow joint complex exclusively moves the forearm. The articulations of these bones result in three separate joints that share a common synovial cavity, which enables the forearm to flex, to extend, to pronate, to circumduct, and to supinate on the humerus. Supination is derived from the Latin root word meaning to throw back, and in this case we can understand how the forearm and hand are thrown back during supination. Conversely, the root word pro is derived from the Latin word towards the front, or to advance, and you can visualize the hand and forearm rotating towards the front during pronation, especially from the anatomical position. The large humero-ulnar joint, visualized here, is a simple hinge joint between the trochlear notch of the ulna and the medially located trochlea of the humerus. It allows for the forearm movements of flexion, extension, and circumduction. So if you're wondering how the arm circumducts at the elbow, if you gently, or I should really say if you firmly grasp your arm just superior to the elbow and work your forearm in a circular manner, this is the movement of circumduction at the elbow. The humeroradial joint is another hinge joint between the laterally located capitulum of the humerus with the head of the radius. The humeroradial joint allows for flexion and for extension of the forearm. Lastly, the proximal radio-ulnar joint is a pivot joint formed by the circumferential head of the radius that sits within the radial groove of the ulna. Movement at this joint allows for pronation and for supination of the forearm. Dynamic joint stability of the elbow primarily occurs by four structures that create compressive forces to hold the bones of the arm and forearm in close contact with one another. The outermost joint capsule is a fibrous structure that secretes synovial fluid within itself to lubricate the joint. The joint capsule is thickened and strengthened medially and laterally to form the ulnar and radial collateral ligaments, respectively, which both stabilize the flexing and extending motion of the arm. Lastly, the annular ligament wraps around the articular head or the circumferential head of the radius and helps to hold it tightly to the ulna during movements of pronation and supination. Movement of the arm is generally conducted by flexors or extensors located superiorly in the arm. These groups of muscles are located in what is referred to as the anterior and posterior compartments. These two compartments are distinct in the functionality of the muscles in which they contain and are separated by two fibrofascial sheets, the medial and the lateral intermuscular septa. The three muscles of the anterior compartment are innervated by the musculocutaneous nerve formed by ventral primary rami C5, C6, and C7. The one muscle in the posterior compartment of the arm is innervated by the radial nerve, which is formed by ventral primary rami C5, C6, C7, and C8. Besides the muscles, some other noteworthy structures in the arm include the brachial artery, the ulnar nerve, the median nerve, and the basilic vein, which are located medially. Laterally, we have the radial nerve, the profunda brachii artery, and the lateral cutaneous nerve. The superficial cephalic vein can also be located within the subcutaneous tissue superficial to the anterior compartment of the arm. We will now take a dive into the musculature of the arm. First and foremost, the proximal At the proximal end, the brachialis arises from the anterior surface of the distal half of the humerus and to the adjacent intermuscular septa, more so medially. Its distal attachment is the anterior surface of the coronoid process of the ulna. The brachialis is supplied with nerves C5 and C6, with a small part of the lateral aspect of the muscle supplied by the radial nerve, C7. The action of the brachialis is to flex the elbow, with the forearm pronated or supinated. The biceps brachii proximally has two heads, a long one and a short one. The two heads unite distally and in the lower part of the arm, here. The proximal attachment of the short head is at the tip of the coracoid process of the scapula. The proximal attachment of the long head arises within the shoulder joint capsule. It is attached to the supraglenoid tubercle of the scapula. It then enters the bicipital groove between the lateral edge of the lesser tuberosity and medially at the greater tuberosity. It is converted into a tunnel by the transverse humeral ligament, which is a thick band uniting the bony margins. The biceps brachii is innervated by the musculocutaneous nerve derived from ventral primary rami C5 and C6, and its actions are to serve as a powerful supinator as well as being a flexor of the elbow, particularly if the forearm is supinated. In addition, it acts to some extent as a flexor of the shoulder due to its attachment. The coracobrachialis muscle originates from the tip of the coracoid process of the scapula, medial to the short head of the biceps. Its distal attachment is the medial aspect of the mid-shaft of the humerus. The coracobrachialis' nerve supply is the musculocutaneous nerve derived from C5, C6, and C7. The coracobrachialis acts to flex the arm forward and medially. The previous three muscles were located in the anterior compartment of the arm. In the posterior compartment, which is also referred to as the extensor compartment of the arm, the triceps is a large muscle that arises from three heads, those being the medial, the lateral, and the long head from which it gets its name. The proximal attachment of the medial head of the triceps arises from the posterior surface of the humerus below the radial groove, as well as from the adjacent medial and lateral intermuscular septum. It is overlapped posteriorly by the long and the lateral heads. The proximal attachment of the long head of the triceps arises from a tendon attached to the infraglenoid tubercle of the scapula. The long head supports the inferior aspect of the shoulder joint capsule when the arm is abducted. The proximal attachment of the lateral head of the triceps arises by a flattened tendon from the upper border of the radial groove, from the lateral border of the humerus and lateral intermuscular septum. This muscle inserts into the posterior surface of the olecranon process of the ulna, which is visualized distally here. It also inserts into the capsule of the elbow joint and the antebrachial fascia. This muscle is innervated by the radial nerve, derived from ventral primary rami C5, C6, and C7, with each separate branch going to a different head of the triceps brachii. The action of the triceps is to serve as a powerful extensor of the elbow. The axillary artery supplies the arm and becomes the brachial artery after it crosses the inferior border of the teres major muscle. The brachial artery courses through the medial side of the arm and terminates anteriorly at the elbow when it bifurcates into the radial and ulnar arteries. However, before its termination, the brachial artery gives rise to the profunda brachii, which is also referred to as the deep brachial artery. The profunda brachii descends with the radial nerve posteriorly along the spiral groove of the humerus before it gives rise to the middle collateral artery and the radial collateral arteries. Other important arteries in the arm include the superior and the inferior ulnar collateral arteries. There are three main nerves that innervate the arm. The musculocutaneous nerve innervates the muscles in the anterior compartment of the arm, those being the brachialis, the coracobrachialis, and the biceps brachii. The musculocutaneous nerve arises from the lateral cord, pierces the coracobrachialis muscle, and descends through the arm between the biceps brachii and the brachialis muscle, and terminates as the lateral cutaneous nerve of the forearm. It innervates the muscles of the anterior compartment of the arm and also provides sensory innervation. The radial nerve innervates muscles of the posterior compartment of the arm, that single muscle being the triceps brachii. The cutaneous innervation of the arm is supplied by the radial nerve and the medial cutaneous nerve of the arm. It arises from the posterior cord and descends posteriorly to the humerus along the spiral groove with the deep artery of the arm. The radial nerve pierces the intramuscular septum and courses anteriorly to the lateral epicondyle between the brachialis and the brachioradialis. It then descends in the posterior compartment of the forearm. The cutaneous innervation from the radial nerve provides sensation via the posterior cutaneous nerve of the arm, the inferior lateral cutaneous nerve of the arm, and the posterior cutaneous nerve of the forearm. Lastly, the medial cutaneous nerve of the arm branches from the medial cord and supplies the anteromedial skin of the arm and the forearm. The forearm, also referred to as the antebrachium, consists of the radius, which is located laterally, the ulna, which is located medially, and the respective muscles, nerves, and blood vessels that move through this anatomical region. Proximally, the forearm articulates with the humerus through the elbow complex, aka the humero-ulnar and the humero-radial joints. Distally, the forearm articulates with the carpal bones through the wrist complex, enabling a wide range of actions, including wrist flexion and extension, lateral deviation towards the radius, medial deviation towards the ulna, as well as pronation and supination. Forearm muscles are organized into two fascial compartments, similar to those of the arm muscles. The anterior compartment contains flexor muscles, innervated by the median and ulnar nerves. The posterior compartment contains extensor muscles, innervated by the radial nerve. The muscles in the anterior compartment of the forearm all have common attachments, those being the medial epicondyle of the humerus, whereas the muscles in the posterior compartment have common attachments to the lateral epicondyle of the humerus. The muscles in the anterior compartment of the forearm are divided into three groups: a superficial, intermediate, and deep group, which are all innervated by the median nerve, except 1.5 muscles that are innervated by the ulnar nerve. These muscles that are innervated by the ulnar nerve will be highlighted in yellow. The superficial group includes the pronator teres, which serves to pronate the forearm. The flexor carpi radialis flexes the forearm and provides radial deviation in the lateral direction. The palmaris longus is a weak flexor of the forearm and also helps to resist shear forces, those being twisting forces in the arm. Lastly, the flexor carpi ulnaris, which is innervated by the ulnar nerve, both flexes the forearm and provides ulnar deviation medially. Deep to the superficial group, the intermediate group of muscles contains the flexor digitorum superficialis, which is responsible for flexion of the second, third, fourth, and fifth metacarpophalangeal joints, and the second, third, fourth, and fifth proximal interphalangeal joints, as well as flexing the wrist. Again, the name of this muscle is the flexor digitorum superficialis. The anterior compartment of the forearm deep group of muscles include the flexor pollicis longus, which flexes the thumb, which is also anatomically referred to as the pollex, at the metacarpophalangeal joint and the interphalangeal joints. Remember that the pollex, or the thumb, only has one interphalangeal joint, whereas digits 2 through 5 have two interphalangeal joints, a proximal and a distal interphalangeal joint. The flexor digitorum profundus provides flexion of the wrist, the 2 through 5 metacarpophalangeal joints, the proximal interphalangeal joint, and the distal interphalangeal joints. This is another muscle where only half of it is innervated by the ulnar nerve. The last muscle of the deep group is the pronator quadratus. The pronator quadratus also serves to pronate the forearm. The posterior compartment of the arm is divided into a superficial and a deep group. The posterior compartment does not have an intermediate group the same way the anterior compartment of the forearm did. In the superficial group of the posterior compartment of the arm, the brachioradialis assists with elbow flexion, primarily in the mid-pronated position. Both the extensor carpi radialis longus and extensor carpi radialis brevis extend the wrist and deviate the hand laterally towards the radius. Extensor digitorum extends the wrist and the metacarpophalangeal joints and weakly extends the interphalangeal joints. Extensor digiti minimi extends the fifth digit, also referred to as the pinky. Extensor carpi ulnaris both extends the wrist and provides ulnar deviation medially. Lastly, the anconeus muscle contributes to elbow extension. The anconeus is located in the lateral aspect of the elbow joint. And last but not least, the deep group of the muscles in the posterior compartment of the forearm include the supinator, which, true to its name, supinates the forearm. The abductor pollicis longus abducts the carpometacarpal joint of digit number 1, that being the pollex or the thumb. The extensor pollicis longus extends all joints associated with the pollex, including the carpometacarpal joint, the metacarpophalangeal joint, and the interphalangeal joints. Extensor pollicis brevis extends digits 1 at the carpometacarpal joint and the metacarpophalangeal joint. Extensor indicis acts to assist in extending digits 2 independent of all the other digits. So the indices or the index finger is the second digit. And this muscle helps to extend that one. There are 3 main nerves that innervate the forearm: the median, ulnar, and radial nerve. The median nerve provides numerous terminal branches, including the main branch of the median nerve, which innervates the superficial and intermediate muscles of the anterior compartment. The anterior interosseous nerve innervates the flexor pollicis longus, pronator quadratus, and the radial half of the flexor digitorum profundus muscles. The palmar branch provides cutaneous innervation to the lateral side of the palm. The ulnar nerve courses posteriorly to the medial epicondyle of the humerus before entering the forearm. The main branch of the ulnar nerve innervates the flexor carpi ulnaris and the ulnar half of the flexor digitorum profundus before advancing distally to enter the hand. Proximal to the wrist, the ulnar nerve gives rise to 2 cutaneous branches, a dorsal branch and a palmar branch. The superficial radial nerve provides cutaneous innervation to the dorsum of the hand, and the posterior cutaneous nerve of the forearm arises from the radial nerve in the arm and supplies the skin to the posterior forearm. Which can be visualized here. Lastly, the medial cutaneous nerve of the forearm branches from the medial cord and supplies the medial skin of the forearm. The brachial artery gives rise to the radial and the ulnar arteries, which supply the anterior and posterior compartments of the forearm and extend distally into the hand. The anterior and posterior ulnar recurrent arteries arise from the ulnar artery and move around the medial epicondyle of the humerus to anastomose with the inferior and superior collateral arteries of the ulna, respectively. The common interosseous artery courses towards the interosseous membrane and bifurcates into an anterior and posterior interosseous branch. It also gives off a recurrent interosseous artery, which travels superiorly posterior to the elbow and eventually unites with the middle collateral artery, seen here. Lastly, the radial artery travels through the cubital fossa along the lateral side of the forearm, deep to the brachioradialis muscle, along the flexor pollicis longus muscle. The pulse of the radial artery is often felt on the lateral palmar surface of the wrist, which is on this side. The radial artery gives off a radial recurrent artery, which courses anterior to the lateral epicondyle of the humerus to eventually anastomose with the radial collateral artery, visualized here.